No, we basically are ready for you. We have very interesting people. We would love to, but 50 independent physician in Clark County will be difficult. But I think we can get 50 in Atlanta. So I just want to learn from you. We basically, the physician mind is a mind of difficult mind. It's difficult to put even good thing in it because they just don't want to listen to. It takes about 2 or 3 times, 4 times, 5 times before talk to you. Now, do you have any concoction which can shorten that time?
Well, if the physicians decide not to upgrade to the Ferrari or the Mercedes and invest in this, we're in. They gotta love this like they love their cars. Physicians have no problem spending on cars, but they need to focus on their future and their control. The problem is they don't see it. This is a subtle erosion of our future. These insurance companies, these hospitals are eroding us more and more every day. You close your eyes, you imagine how you practiced 10, 15 years ago, totally different, totally different. And if you close your eyes and you don't do anything, in 10, 15 years, you're gonna be handcuffed further. And it's ridiculous. It's not right, it's not fair, it's not why we went to medical school. So the doctors need to step up. We are gonna prove the business model in Palm Beach County so you're comfortable for it when you're ready. We are going to work out the kinks and we are going to make it more cost effective for you guys to participate in this magnificent plan that's been around for 50 years, creating a tremendous amount of wealth for insurance companies throughout the country. And it's time for us to get a piece of that.
All right. The question is, one of the specialists who did not recognize himself say, what about a specialist? Can they become primary care physician to join?
Well, specialists can absolutely join and they're going to participate in it. Oh. They're going to raise money. They're going to be part of our pool of investing, no doubt. But it is ultimately a PCP endeavor, and we need PCP commitments. And we need PCPs to take the little risk. We are taking the big risk down here, and we are going to make it less of a risk for Doctors ACO or New Jersey ACO when they're ready.
So that especially with Dr. Shaw, you identify Dr. Shaw is our board member in the Doctors ACO, and he's a top-notch ophthalmologist. And so I'm sure we're going to need his service in the Medicare Advantage plan. Great. So please come on and ask question. You can raise your hand and unmute yourself. And this floor is open for question. Okay, Rohit, go ahead.
Okay. So Arthur, my God, what a thorough and an excellent lecture, Thank you for that. So I know I'm part of this program, and do you think we are ready if we have enough grassroots and enough doctors in other states? You think we are ready to start? If so, when? In other states?
I think if we have enough grassroots in one area, in one county, it will be much easier to explore and go down that path. We don't want to stumble. We like to do things that are a home run. We like to succeed. We are winners. And the winning formula is a large amount of primary cares that are committed to this program. This will not bear fruit immediately. You will not see a lot of money return year one. If you want a lot of money year one, this is not it. But you will see a significant equity value in a very short period. I believe, and we are planning on to get a fair market value of our Medicare Advantage in about 6 months. I believe it's going to surprise everybody on the value that we created. We talk about how wonderful our network is. We have a network of specialists. We have a network of primary cares. We always talked about it. We never had a network until we did the Medicare Advantage plan. Now we have DME, we have pharmacy, we have Uber, we have nursing homes, we have home health, all contracted at a nice lower rate. So the reason, and now we of course have hospitals. So we are a step away to even compete in the commercial arena. You know, once we're successful after this 1 year, we'll go to the school board. We'll cut them 30% and cut them out. We have that ability because our network, I'm not going to say the number that I think we're valued at, but it's going to be a tremendous already equity return just because we spent a lot of time to build a network. We built the largest network in Palm Beach County than any other legacy HMO plan in here that's been here for 50 years. We have the largest one in the county, and that's what we're going to do in Georgia. And the reason why we need a lot of primary care physicians, because when we go to the hospitals, we can negotiate a better rate. When we go to the nursing homes, we can negotiate a better rate because they're going to see that it is not a mom and pop plan. We already have critical mass in terms of providers in our network. So the attention will be, the spotlight will be on us then.
So we are ready to expand. Are we ready to hit the ground running?
We are ready when you guys are ready to have that grassroots.
Okay.
So if the grassroots is there, and that's the energy, yes, but let's not go there and force feed it to the physicians. They have to want it.
So
Okay.
I think that you have told us what to do, and please, we basically getting things ready here in Georgia. And Vinod Bhai, you heard him, is that right? You
Yes,
heard him.
yes, yes.
So he's coming. Just see,
Just,
we invite him. You know,
I have a question for Arthur, so I know this, everybody would want to have a pie of managed care plan. As you said, every year, every state, the number of managed care patients percentage-wise are going from Medicare to traditional Medicare to managed care.
Yeah.
So now, when you say you want a critical mass of provider, PCPs, so how PCP will help and facilitate and enroll those patients under so-called physician-owned managed care plan? So patients are already in United Health managed care plan or Aetna Medicare plan. In Jersey, there are a lot of big employer like Verizon, Merck, Pfizer. Those patients, all the retirees are forced to choose Aetna Medicare PPO plan. So we lose every year close in our ACO, close to 1,000 patients from traditional Medicare to managed Medicare. So my question to you, how we are going to route those patients who choose either Aetna at behest of the corporation, whether it could be big corporation Verizon or AT&T or Merck retirees, which they force and they have contract with Aetna versus United versus us.
Okay, so I can't speak specifically on your situation or those situations, but I will tell you the math makes sense. What does that mean? We don't have a tremendous amount of money that we have to pay for advertising. We don't have to pay a tremendous amount of money for administration or high-powered CEOs, et cetera, et cetera. We don't have to pay a decent amount of money or a portion of our money to the MSOs. Thus, that extra money, we can provide a tremendous product to the patients. We in Palm Beach County have created the best product for our patients. Nobody can touch our product that ultimately our patients will get. So we take care of our patients first, and then we take care of our providers second. And we believe if the providers believe in the plan, then it's easy to recommend something they're proud of. So a doctor recommendation to a plan goes miles and miles for a patient. And even the doctor can tell the patient, I mean, some doctors here are moving membership by telling them, listen, I'm a part owner in this plan.
Okay.
This is a local plan. I'm part of it. If you have any issues, I assure you, I will take care of that plan. In Palm Beach County, just to let you know, our plan has no referrals. It has no copays for ER, urgent care, anything across the board. covers all no copays for medications. We have tremendous dental benefits, tremendous hearing aid benefits. We have transportation. We have Uber, Lyft. We obviously have the traditional transportation. We provide food for our patients after they've been hospitalized. We are cutting edge in our thinking because not me, but because of all of us, because our providers provide a lot of intuition and provide a lot of advice of what should be potentially or could be done. We look at the math, and if it could be done, we do it. We do it. So we are putting the insurance company upside down. I don't think the insurance company can do what we're doing. Otherwise, it's going to take money out of their 20% at the top, their portion of their MSO, this. And we are just a blip in the radar for them. They're not even thinking about it right now. Maybe in the future they're going to have to, but right now they're not thinking about it. The only thing we are missing is a track record, and we're missing name recognition. That's where we want the doctors, the large amount of doctors, to recommend it. Dr. Sanchetti, Dr. Agarwal, you guys have tremendous relationships, and your entire membership has tremendous relationship with patients. When you recommend something like this, they will explore it. And once they explore it and realize the product is better because we have money to spend on the patients, they will invest, they will consider it and hopefully move membership. And we're not talking about a tremendous membership. We need to be sure, though, that we have the doctor support, the doctor recommendation to move the membership. And we don't want a lot of membership. We just want our fair share of our membership to be successful and viable.
Arthur, may I?
Yes, sir.
Arthur, I don't agree with you on 2 points. One is we do have name recognition. We are Palm Beach ACO and Associates, and we have a track record. Palm Beach ACO is the biggest ACO in the country, and we extend from sea to shining sea in the USA. So
yes,
I think you're being very humble.
Yes, well, from the operations side, we do, but from the patient perspective, they don't see the commercials, they don't see. But in any event, thank you, Rohit. I agree. We do have a track record, and we, like you said,
name recognition. We've been featured everywhere. We've been featured on Wall Street. We are the oldest. We are the biggest. I think we are the Microsoft of ACOs and such.
Yes.
I agree with that. You know, I support my friend here, Rohit. You are very humble. You've been great. So there are 2 questions in the question. See if we can read that for me. One is from our primary care physician, Clara Vestation. And do you have access to the question, or do you want me to?
Yes. Aside from providing the initial capital outlay and the Medicare Advantage plan patient, would you allow PCPs to actively be involved in negotiating with payers, administration of new organizational entity as well? Dr. Vistosian. It's very possible if somebody wants to assist in negotiations, that's fine. Right now, though, we do have an entity, but if anyone has contacts or can assist in negotiations, absolutely. Our physicians have helped create a very large network. And when we could not get a neurosurgeon at a decent rate, what do? We call our biggest referral source to those neurosurgeons. Hey, we need this group. Can you help us get them in network? So when we're building a network, you need to have a minimal number of everything to cover the patients from county border to county, from line to line. And that's why it's much easier when we have doctors that know entities. We needed help with certain hospitals, and we had doctors step up and open the doors for that. So it is a grassroots effort. It's nothing that we can push. So yes.
So Dr. Safia is also our primary care physician. Her question.
Yeah, will you be able to have MSSP with this Advantage plan? Absolutely. You are losing a percentage of your MSSP patients every year. So if you're losing, 5-6% of those patients for socioeconomics, push them to the Medicare Advantage plan that you own. Yes, we are not giving up the ACO business. We are in the ACO business. We are in it to win it. We will win it. We are winning it. We are going to have over 100,000 Medicare fee-for-service lives in Palm Beach ACO for 2021. We're very excited about that. But if we're going to lose 5%, we're going to lose 5,000 Medicare fee-for-service lives. Why are we going to push them to another entity? Let's push them to our entity to get another bite of our apple. It's our apple. Why are we going to share it with somebody that doesn't really like us and uses us like a commodity?
Okay, there's another question from Dr. Aaron.
Are you currently dealing with commercial ACOs in Palm Beach ACO, or is MA plan only? Yes, we have 5 commercial ACOs, and we are happily successful in all of them. We have Blue Cross, we have Aetna, we have Cigna, we have United, and we have Oscar.
Hi, are you able to hear me? This is Dr. Aaron.
Yes.
Sure, please do.
I am the senior medical director for Blue Cross Blue Shield Florida. And I recognized Palm Beach ACO, but I didn't know if you were working for the commercial ACO or is some other medical director representing the commercial ACO.
So our PBACO is contracted at risk for Blue Cross and Blue Shield commercial lives, and we probably have close to 50,000 commercial Blue Cross and Blue Shield lives in South Florida, between the
Right.
between Treasure Coast, Palm Beach County, Broward, and Dade County.
Right, but are you the medical director representing that ACO?
The medical director of Palm Beach ACO is Rohit Dandia.
Okay.
He's in
Okay.
meeting here. Now, Rohit, come on, get up.
Here I'm waving my hand. There's no.
Yeah,
Yeah.
I see you.
And,
Yeah.
and
Yeah.
Arthur Henson is the CEO, is the mind behind the whole.
Oh, he's the CEO. Okay, so
That's
I'll
great.
probably
Glad you joined us, Arun.
yeah. So I am actually the senior medical director for state of Florida for Blue Cross Blue Shield for provider engagement and value-based care. So I'm sure I'll be interacting with
Awesome.
you guys. Yeah.
Awesome. Reach out. We'll love to swap notes. Maybe you can help us get a better contract for next year.
Where are you located, Dr. Arun? Where are you in Palm Beach County, South Florida?
No, I'm at the headquarters of Florida Blue, Jacksonville, Florida.
Okay.
Really? Wow.
Well, whenever you're in the area, we look forward to meeting you.
Sure, yeah,
And you're
certainly.
going to have a good time. I guarantee that. Those people know how to have fun. So let me ask you, anybody else who might have a question? I think, Sophia, you have a question. How will we convince hospital and specialists to participate? Yeah, this is a question for you, Dr. Henson.
Yep. Again, it goes to the critical mass. Look, we are combining our ACO network and our MA network. So you want our ACO fee-for-service patients, you also need to be accepting this insurance plan. If in Palm Beach, because that's where we're doing our Medicare Advantage plan, we're not in Dade or Broward yet, but in Palm Beach, if you are not in our Medicare Advantage plan in 2021, by the end of the year, you will be kicked out of Palm Beach ACO. We are going to have one network because you're right, specialists may have a tendency to do one thing or the other. The hospitalists have been no issue. They're eager, they're unhappy with other Medicare Advantage plans, and they are looking forward to our success because they would rather negotiate with us than negotiate with some of these other legacy plans.
Some question from Dr. Raman Khosla. You want to know what is the name of your plan? And Dr. Khosla, if you're there, please come on and ask the question directly yourself.
So I can answer that, obviously. So we are Prominence Health of Florida. So a little bit more information. we wanted to raise a set amount of money for 5 years of operation. The barrier to, like we talked about, to get into a Medicare Advantage is crazy high, and it's variable when it comes to something called the reserves. And the reserves, you need to have pay 20% of the total cost of that patient in the state. Now, I don't know, I can't speak for Georgia or New Jersey, but for Florida, it's 20%. So we strategically partnered with a small to medium-sized company out of Reno called Prominence Health that has been in Nevada and Texas. And now we have a joint venture with them for the entire state of Florida. And they are owned by a Fortune 500 company, and they are securing our reserves up to $200 million. So we feel very, very comfortable, because at the end of the day, we understand the mindsets of our physicians. We understand that they don't want to have a capital call every year. So meaning that if we go into this market and in year 2, we grow from 5,000 patients to 15,000 patients, but we only expected 3,000 patients, we may have to come up with $15 million in 30 days for reserves. Therefore, we would get the money through this company from Prominence Health. And we know what we don't know. We don't know how to adjudicate claims. We don't know the compliance. We don't know the risk. We don't know a lot of this stuff. So we partnered with this company of Prominence to accelerate our success. And we think we've accelerated our success by at least 5 years by partnering with this company. And that we are learning the business. If we decide to go to Georgia or New Jersey, we have to assess how much we've learned to either consider doing it on our own 100% or to strategically partner with somebody that has some deep pockets for the reserves. Because the reserves is a fluctuating number and it's a scary number. And we've seen insurance companies close, successful insurance companies close. The one in Florida was called PUP about 4 years ago, closed because they could not come up with the amount of the reserves in 30 days that they needed. And the state came in and closed them. Very sad. Took all their patients and gave them to the legacy plans.
So Arthur, looks like we've covered all the bases, and I've been watching you closely, and I really don't see any pitfalls here. And coming back to, I mean, there's a lot of people here who do understand in Hindi, and I'll explain to you what I'm saying in Hindi. It's chamatkar ko namaskar. Means, okay, which means,
Translate, please, translate.
Translate, chamatkar ko namaskar means those who dazzle get the respect. Okay, and that's what we have done at Palm Beach ACO and Prominence. So we, again, I think we have a legacy, and I'll think with you, Arthur, we can take this legacy and dazzle people anywhere,
Okay.
as long as they are ready and as long as we don't have to solicit them too hard. So chamatkar ko namaskar means dazzle.
Yes, Arthur.
When you dazzle, they follow you.
Yeah, Arthur, I have a question. I want to ask you a question of timeline.
Yes.
So when the people have to say, listen, we are ready, then we invite you, show you our strength.
Yep.
And then you put out the application, and then when we get approval. So could you just tell us what the timeline is?
So it's an aggressive timeline. Usually it would be a deadline in March to submit. And then we would need to get some level of approval in the summer, June or July. But the trick would be that we would need to show an estimated network when we apply in March, and we would be able to we would have to show our entire network, sign contracts, et cetera, by July, and show the proof of funding and the ability to show the capital reserves and ability to show that we are experienced. In Florida, they do not give it to anybody. I'll give you an example. It took us 2 years to get our application approved in Florida. And we are convinced that Tallahassee, the capital, and the OIR, the Office of Insurance Regulations, would just simply be playing games. Our application was 100% complete. It would take them forever to look at it. They would make one comment. We would address the comment in hours. They would respond and ask for another 10 comments a month later. And then we would fill those out, send them back. And then next thing you know, they asked for 30 questions. I mean, they just were very, very difficult. We had to hire a Tallahassee lobbyist to get us through the second year. And it was a little bit of a shame because we delayed a year, but we learned and we grew our network even bigger. There's politics in it because they just don't want to give an insurance company to anybody.
So now we come with you, then we are part of you.
Yes. So they do not want to give it to anybody. But they want to, their primary thing is to protect the patients, to protect the integrity of the insurance. They do not want to see an insurance company close rapidly for some reason or not. And the reason why the reserves are so high is because if we don't pay our bills, they pay the bills out of the reserves.
Awesome.
So this is Dr. And I mean, I looked at the presentation. I have been in this value-based engagement for the last 10 years. I was the CMO of Aetna. I was the corporate senior medical director for Humana, all in population health and the value-based. I really am pleased to know the work that I have been trying to do, provider engagement and coaching, and really felt that the population health management should be at the granular level. It should be at the primary care physician level, and that's what you're doing. So I'm glad my, all the efforts that I had kind of put in over the 10 years, that is just being worked out at the granular level. And I'm very pleased that you're on the right track, and that's the track for success. And the metrics that you showed and the variables and utilization management and quality metrics, that's what will get you the success. So that's what we are trying to engage our physicians in.
So Dr. Arun, how can we move you to Georgia?
No, I'm settled here. But
Thank you for joining us. We really appreciate you joining us, give us an inside story. And let me tell you, this group of doctors now determined they are rebel, they are independent, and we're going to do everything we can do to keep independent physician independent. So this is our motto from Doctors SEO, Palm Beach SEO, New Jersey SEO, and others. And I can tell you that this is the best way to deliver healthcare in the United States.
Exactly. So one word of caution, the entire success depends on data analytics. So as long as you have very strong and robust data analytics and data interoperability, it especially when you're dealing with Medicare Advantage, you have to be very careful with the data, and you will succeed if you manage the data very well.
Great advice.
Okay, sir. Good night. Thank you. Nice talking to you all.
So Arthur, you were awesome. And Rohit, impossible, just beautiful, just simple, nice, better. It's really lovely presentation. And Derek, you just knock everybody down with a good data together like that, and this care tracker. And David, we can't do without you. You just awesome. So thank you all.
Master was also
Listen, don't let these people go from your ACO. So keep them together, keep them close to you. So I appreciate everybody joining us. It's getting late, but we really thoroughly enjoyed. Hopefully we'll see you, Dr. Hansen and his group. And David, can we bring him before March to see the strength, see if he like us start his next operation in Georgia?
After this meeting, absolutely.
Thank you all.
Thank you.
Bye-bye.